As you know, cancer is a horrific disease that spreads as long as it goes untreated. The earlier cancer is detected in its host, the easier it is to treat and the less suffering it causes. Breast cancer and testicular cancer are not exceptions. If they advance too far, the only viable forms of treatment may be the removal of the breasts and testes respectively. Fortunately, there are ways to check for early signs of these cancers using just your hands. Performing your relevant type of exam once per month is highly recommended. When examining yourself, try to keep conditions as consistent as possible. For example, a woman's breasts can feel different at different periods of the menstrual cycle, and a man's testes can feel different after ejaculation. Factors such as angle of the examination can also cause differences. One of the most important aspects of both examinations is to remember how your body feels so you can identify significant differences. Abnormalities are not a sure sign of cancer, so if they are detected, contact a physician for official diagnosis. I personally suggest everybody learn about both types of self examination. It is possible, albeit rare, for men to develop breast cancer. Also, knowing about the other body type will allow you to educate or even personally inspect your partner. Guys, don't you want an excuse to put your hands on some boobies? With consent, of course. And ladies, just be gentle with your man's goods, please. It's a good way to be intimate with your partner while doing something productive. There are 3 parts to a breast self-exam. The first part can be done in the shower. Using your fingers, make circular patterns around your breast, starting on the outside and moving in. Check your entire breast and armpit area, including both sides. Abnormalities include lumps and areas of thickening or knotting. The second part is done in front of a mirror. With your arms at your side, check for changes in the breast contour or nipples, swelling, or especially dimpling. Repeat this procedure with your arms above your head, then with your hands pressed against your hips to flex your chest muscles. Most women's breasts are not symmetrical, with minor differences in size and shape. This is normal. For the third part, lie down so your breast tissue spreads evenly along your chest. Place a pillow under your right shoulder and put your right arm behind your head. With your left hand, move your fingers in circles around your breast as you did in the first part. Use light, medium, and firm pressure. Check your nipple by squeezing it. Men, come on, don't you want in on this? After finishing the right side, repeat for the left and you're done. Experts recommend getting a clinical exam every 3 years between the ages of 20 and 39, then getting a clinical exam and mammogram yearly starting at 40. As I said before, learn how your breasts normally feel and see a physician if a major abnormality arises. Testicular self-exams are quicker than breast self-exams, but thoroughness is still important. Stand in front of a mirror and look for swelling on your scrotum. Hold your penis out of the way. Place your thumb on top of one testicle and 2 fingers on the bottom. Gently roll the testicle, checking for lumps or firmness. Repeat for your other testicle. A normal testicle is smooth, oval-shaped, and uniformly firm. The epididymis is a tube connected to the testicle. It can be felt while examining yourself and is not an abnormality. Abnormalities include changes in size, shape, or texture, collection of fluid, pain or swelling in the scrotum, and lumps or nodules. That's nodules, not noodles. Remember, guys, we already moved those out of the way. Again, get to know your testes and contact a physician if you detect a major abnormality. Symptoms of testicular cancer include difficulty getting erect, abnormal intensity, frequency, or control of urination, blood in urine or semen, and pain or numbness in your lower body. None of these symptoms are exclusive to cancer, so don't panic if your foot hurts and you can't get hard one day. If you have any questions or concerns, consult a medical expert or one of the cancer-related organizations shown here. Stay healthy.